I'm Korean, I'm from Vancouver, and I work in the emergency department in Vancouver. So we came down here almost a week ago, and for about 4 days, we've been visiting different towns and trying to help out and sort cases that may benefit from undergoing surgery. So for the first time on this mission, we've been using an ultrasound machine, which is portable, and we've been trying to sort out some of the cases through using this ultrasound. And it's helped in certain cases where the diagnosis was not clear and became clear when using that ultrasound. So for instance, there were cases where patients came in with masses that looked like lipomas, but when using the ultrasound, we saw it was actually a hernia. So it was an ultrasound that was donated through another team member here who had done some fundraising through her Rotary Club. And thanks to her and her fundraising, we obtained this portable ultrasound unit. So I was a bit prepared on this mission in that one of my family practice preceptors from approximately 10 years ago had been on this type of mission about a year ago. So he told me a bit about the cases and the sorts of patients to expect. And I was also prepared in that there was going to be an ultrasound, so I reviewed some of the cases that could benefit the other doctors on the mission. So far it's been phenomenal. I am very fortunate to have been working with great translators, other physicians and nurse practitioners and nurses who were open in discussing the cases. I didn't know if it was going to be a very collaborative kind of teamwork, but I loved circulating the patients and bouncing ideas off the other practitioners and having them send patients over to do some scans and then confirm or I guess elaborate or see a bit more about the diagnosis through the use of the ultrasound. So about 7 months ago, I finished extra training in ultrasound, point of care ultrasound for the emergency department. So I was able to teach some of the physicians here and some of the docs who were interested as well in using some of these point of care applications. For instance, we reviewed cases of inguinal hernias. We reviewed how to measure fetal heart rates. We saw a few pregnancies here. We even reviewed some scans, some cardiac scans, and how to distinguish several types of lumps and bumps, including swollen lymph nodes. So I put my learning to good use in transferring that knowledge to these physicians who hopefully are going to be able to carry on and continue using this kind of ultrasound and its applications.